Although some sports have higher instances of concussion, such as football, hockey, soccer, concussions can happen in any sport or recreational activity. Welcome to the GW Healthcast. I'm Dr. Mike Smith, and today's topic, managing concussions. My guest is Dr. Gobinveer Sahi. Dr. Sahi is a primary care sports medicine and concussion specialist and is affiliated with the George Washington University Hospital. Dr. Sahi, welcome to the show.
Thank you, Dr. Smith. Good to be here.
So, more and more, I think my audience is hearing about concussions. I know it comes up a lot during football season. I know the NFL is focusing more on how to prevent concussions and manage that. So I think that most people understand the idea of a concussion, but maybe not fully what it is. So how about let's start with what actually is a concussion?
Sure. So for the general audience, you can sort of attribute a concussion to being a contusion of the brain without actually having a mark. It's a temporary change in the internal brain chemistry as well as hormones. There's a complex cascade that goes on. Most of the time, over 95% of the time, imaging studies are going to be normal. It is a transient period. Most concussions will resolve within about 4 to 6 weeks, give or take a few weeks on each end. And they are, again, as we said, temporary changes in brain chemistry, which will cause a variety of symptoms with regards to thinking problems, physical symptoms such as a headache or nausea. You can have mood problems like irritability and sadness, problems with sleep, affecting interpersonal relationships. So that's sort of the general definition of a concussion.
So how is it, are concussions rated? Obviously, some may be a little bit more severe than others. Is there when you are diagnosing it, is there a rating system for this?
So there used to be, but there isn't anymore. The analogy I give my patients is, if you or a loved one, heaven forbid, had a heart attack, was it mild, was it moderate, was it severe, or was it, just a heart attack that we have to deal with? It's sort of the same thing with concussions. We don't really classify them as mild, moderate, or severe. Right now, it's either you have a concussion or you don't. And if your symptoms last for a period of longer than about 6 weeks, then you can transition to what we would call a post-concussion syndrome.
So, and how common is this? How often do you, as a sports medicine specialist and a concussion specialist, how often do you treat concussion?
Every day, all day, every day. It's unfortunate, but, with our active population or with the military population, people in the workforce, bad weather, any sort of slip or direct or indirect trauma to the head or the neck can result in a concussion. And I think it's important to educate the population on, certain warning signs, what might take place. But I have at least a few concussions every day in clinic. I'd say probably at least 30% of my sports medicine practice right now is dealing with concussions.
Right. And it's not just from sports, as you mentioned. It could be a fall, a slip, a car accident, et cetera. I think sometimes maybe the general audience might hear the word concussion and they automatically think, football, but it can happen in everyday life. You mentioned something that I think is important, like what are those warning signs? So let's say we have a listener who fell, hit their head. What are some of the signs and symptoms they should look for that might tell them they have a concussion?
So obviously a headache, which, wouldn't go away with rest or, hydration and or a Tylenol. Some danger signs, if it's worse than a concussion, would also, be nausea or severe projectile vomiting. If you're having fluid or blood dripping out of your nose or your ears or your mouth, and it's sort of the most splitting headache of your life, those are danger signs, which would mean you probably would want to go to the emergency room. If you're not experiencing those, you still would definitely want to follow up with a concussion specialist and or, urgent care or your primary care physician. But we usually break down the concussion symptoms via an ACE questionnaire. There's 4 main symptom headings that we look for. One is problems with thinking. Obviously, if you're feeling a little slowed down, problems concentrating or remembering things, sort of functioning at your normal level. Physical symptoms would obviously be headache, like we said, nausea or vomiting. Problems with balance is a big one. Changes or blurriness in vision, feeling fatigued, and having sensitivity to light or noise. The mood problems would be, if you're sad or emotional or more nervous than normal. There can also be some sleep problems, such as sleeping more or less, problems falling asleep. So those are sort of the general symptoms to look for with a concussion.
When do you suggest if somebody has a few of those? Like, obviously, some of them sound a little bit more severe, like
Sure.
the blood issue or something, but other ones maybe not so. The mood issues, whatever, maybe just some of the foggy thinking. At what point does somebody actually seek help, or if you get a head injury of any type, should you always just go see help?
If you're standing up, it sort of obviously depends on the individual presentation and the individual patient. If you stand up and you hit your head on a shelf like I did earlier this morning, hopefully you weren't concussed. But if you do have one of those, sort of significant mechanisms of injury you talked about, and you are experiencing mainly a headache and any of the other symptoms, I would probably recommend going and seeking medical care immediately, especially, if it's in one of our youth population and or athletes. What we say is any sort of hit to the head or neck which causes any of these symptoms, the patient or the athlete would have to be pulled out of the game at once, evaluated on the sideline by a trainer, athletic trainer, or another professional, and then follow up with a physician. So, again, if you're in a motor vehicle accident, you slip and hit your head, you're horsing around, or you're a weekend warrior and you're experiencing, maybe more than 2 to 3 of those symptoms, I would probably recommend going in sooner rather than later. The reason for that is because it's important to engage in about 48 hours brain rest, brain and physical rest for give or take 2 days, which means basically don't do anything physical beyond walking and stretching, and try to minimize the noxious external stimuli like light, noise, stress, screens, and reading. One of the important things about concussions is it's different than sports injuries. If you sprain your ankle, you can tape it up, take an ibuprofen, ice it, kind of gut through it. Maybe your ligaments will be a little bit looser when you're later on in life. But, it's an ankle, so, we got 2 of those. But you only get one brain. So if you push through your symptoms,
right.
And the symptoms are getting worse, that's one of the sort of the brain's way of telling you, hey, I need some rest, and you should probably seek medical attention from your primary care physician, a concussion specialist, urgent care, that sort of thing.
Is brain rest pretty much all we do, or is there other treatments you might do based on the severity of the concussion?
Sure. There's quite a few different treatment options. In the acute setting, we would recommend, just if the headache is bad, you can take a regular over-the-counter Tylenol or acetaminophen. We tend to stay away from steroids and or the anti-inflammatories like Aleve, naproxen, Motrin, ibuprofen, and whatnot. Just for the reason that if you overdo those, you can sort of get what we call a rebound headache. Sort of, if you or me don't, have a cup of coffee in the morning, you might get a headache. The same concept is that it thins the blood a little bit. So if there is a 2% chance of a bleed, you don't want to have it bleeding more. So, you would wear sunglasses to avoid the light, polarized sunglasses for outdoor light, blue tinted sunglasses for indoor lights and screens. You obviously would want to put away anything with a screen, your iPad, phone, computers, tablets, whatnot. You wouldn't want to overread too much. Obviously, you would try not to overstress things. One of the problems we find is that, especially here in DC, we have quite a few intelligent, high-functioning individuals. So telling them to kind of not overthink or overanalyze their symptoms and to just sort of let your brain and body heal on its own, that can be a bit of a challenge as well. And then, just the normal things, get good sleep, 8 to 10 hours of sleep at night, 1 hour nap in the afternoon. Again, don't oversleep because you can get rebound headaches from that as well. Hydration is really important. Things with electrolytes, like any of the aids, Gatorade, Powerade, Pedialyte, water. Good nutrition, getting your proteins and carbohydrates in. And then just kind of relaxing. We don't want to do complete social isolation. So depending on, the individual concussion physician's level of comfort, I normally allow my patients to walk a little bit, stretch a little bit. If they have a family dog, they can take them for a walk and just kind of observe them. So those are sort of the things we would do in the acute setting.
Yeah. So what if there's continued problems? If you get through the acute setting and somebody continues to have headaches here and there, maybe the mood issues, does that tell you something else needs to be done?
Well, a lot of times with concussions, there's also if somebody has an underlying disease process that can complicate things a little bit. Sort of like you said, if somebody has, an underlying anxiety and depression or a learning disability, or if they have a history of chronic headaches or migraine headaches, any previous history of neurological phenomena, multiple sclerosis. Those can sort of mimic symptoms of concussion. So you need to weed through all of the, the history taking as well as the physical exam, and kind of get to the bottom of things. But if we have ongoing symptoms, with headache, balance, eye tracking, one of the nice newer things we have is there's actually physical therapy for concussions now, where they'll work on your eye tracking, your balance. A lot of times I'll send patients to see a therapist, for if they're having mood problems, because it's very normal to be a little angry and sad after a concussion. So with the therapy and the physical therapy, those are a couple other things we can do. If symptoms are lasting more than 6 weeks, there's obviously medications we can use to aid in them. And normally we don't tend to image the brain until it's, 4 to 6 weeks out, because like I said, probably at least 98% of all the imaging is going to be normal. In the acute phase, if you're worried about a brain bleed, obviously you would do a CT scan. Now that has radiation, so you need to be careful about that, especially in the pediatric population. Later on, if it's subacute, like we talked about 4 to 6 weeks out, we could always consider doing an MRI of the brain because there's no radiation there. Maybe even a functional MRI or a functional EEG, where we check to see, how the neurons are actually firing, to see if there's, diminished activity in the parietal lobe, the occipital lobe, frontotemporal. So there's a lot of things we can do, actually.
Right. So lots of information covered here. Fantastic information, Dr. Sahi. Let's end this way. What would you like my listening audience to know about concussions?
Well, I think they're very serious, and any sort of trauma to the head or neck, and if you're experiencing, headaches and symptoms, I would definitely seek medical attention as soon as possible with your primary care physician, with our sports medicine docs here at GW. And one of the most important things is to keep a positive outlook on things, because if you're positive and you let your body and your brain heal with time, most concussions will resolve within about a month. But don't overthink things. See the professionals, and hopefully all will be well soon.
Excellent summary, Dr. Sahi. I want to thank you for the work that you're doing, and thank you for coming on the show today. You're listening to the GW Healthcast. Please visit gwdocs.com to get connected with Dr. Sahi or another provider, or call 1-888-4GW-DOCS to schedule an in-person or virtual appointment. I'm Dr. Mike Smith. Thanks for listening.